Austin Faith Dialogue, a public affairs series at the crossroads of religion and life. Austin Faith Dialogue highlights the interaction of the religious community with the social and cultural issues in the area in and around the capital city. Austin Faith Dialogue is brought to you by Austin Metropolitan Ministries in cooperation with KTBC TV. Join us now for this week's edition of Austin Faith Dialogue.
Organ transplantation is undergoing a period of rapid growth due to the advances in surgical techniques and therapy. But keeping up with this growth is the availability of donated organs. Joining us now are Dr. John Oswald, chairman of the Seton Central Texas Transplant Program, and Catherine Jones, education coordinator of the South Texas Organ Bank. Thank you both for being here. This is really an important program for me as host in Austin Faith Dialogue. I have a very pastoral concern about organ transplantation, and through Dr. Oswald, your ministry, your care for one of my parishioners, I have felt a need for this program to come on the air so that we could explain to those who watch Austin Faith Dialogue about the opportunities they have to donate organs. Catherine, welcome. Tell us a little bit about your history with organ transplantation.
Well, I've been involved with the South Texas Organ Bank for the last 4 years, and before that I was an ICU nurse and surgical intensive care nurse at Humana Hospital in San Antonio. We worked with transplant recipients, kidney and heart transplant recipients, and I became very fascinated with transplantation as a whole. And every once in a while I'd hear, well, we're getting a heart from Waco, or we're getting a heart from, you know, another city, and I never really understood what went behind all of that. And I never understood there was the death and the pain that another family is going through. And so I really wanted to become involved with that other side. There was something that I really did not understand that I wanted to gain a deeper understanding of. So I chose to go into procurement, and I've enjoyed it, and I'm going to continue to enjoy it for probably a very long time.
When you talk about procurement, harvesting of organs, and the other side of organ transplantation, you're talking about those people who consider giving an organ to somebody else for the sake of life. That's the business you're in, right? To
Correct.
Keep life going. Talk a little bit about what happens in that process of procuring organ transplantation.
Well, usually the way that the South Texas Organ Bank becomes involved is we get a call from the hospital, usually in the ICU, intensive care unit. So those nurses and physicians identify patients who are potential donors, and those are individuals who usually suffer severe, tragic injuries, like a gunshot wound to the head or possibly an intracranial bleed. These types of patients who what we call meet criteria for brain death. When we are notified, we come out and evaluate the patient to see if they are indeed a suitable candidate for donation. Then we talk with the family about donation and offer them that option. And if they choose to donate, well, then we go on to coordinate the organ recovery by placing the organs for transplant, and then follow up with the family and let them know the outcome of the organ recovery.
I want to talk to you in a few minutes just about that. What are some of the fears, anxieties, thoughts that go through the minds of the families as they consider the possibility of organ donation? But Dr. Oswald, you've been in Austin for a few years. You tell me you're a native Texan.
That's correct.
How about your involvement historically in the organ transplantation here in the city of Austin?
Well, I was fortunate to do my internship at Brackenridge Hospital, and during some of our elective periods, I did an elective with Dr. Jack Moncrief, who was really kind of one of the originators in the kidney transplant program here in Austin. And during that rotation, we were planning to do transplantation of the kidneys here, and we made a trip to San Antonio to watch them do a kidney transplant down at San Antonio at the medical school, and then actually during that year started performing the kidney transplants
here in Austin. And what year was that?
In 1970. And actually I then changed rotations and was on an elective with my current partners, who are the surgeons that do the kidney transplants and now the heart transplants here in Austin, and actually scrubbed in on the second kidney transplant done here in Austin. And so that was my early exposure to transplantation. And then after my training and coming back here into practice, we were seeing patients elect to die rather than go to California or maybe to Houston or somewhere else and live, set up living there so that they would be close to where they would have to have their surgery performed for a heart transplant. And on 2 different occasions this happened with housewives that they couldn't leave their families. They didn't see leaving their families to go set up shop and live there waiting on an organ donation and a transplantation. And so amongst ourselves, our colleagues, the cardiologists and surgeons here in town, we looked into why we shouldn't be doing transplantation here in Austin as a community effort. And after going through all the process of what it would take to do this, decided that it was a possibility, and we started on about a year-long process of setting up our heart transplant program through the Central Texas Heart Institute at Seton. And that began in '85, and actually by the end of '85 we were ready to do transplantation and started receiving potential recipients and listing them, and then in February of 1986 we performed our first heart transplant.
Took a while to make that process work, didn't it?
Took about a year, a little over a year, to get the whole process to working correctly.
What was the reason that you mentioned about the disruption that comes to family life if someone has to go to a larger metropolitan area for such a procedure? But what are some of the other reasons that you, as a physician, as a person who obviously cares for people, who is a skilled professional, what are some of the other reasons you were interested in transplantation?
Well, it's at the time we decided to start doing that, it was kind of on the leading edge of technology. We'd had a change in the regimen of medications that were available to the recipients, and we were seeing a much better outcome in the survival rates of transplant patients. And so, you know, anytime you're dealing with a patient that has a terminal illness, and most of these patients are predicted to die from their cardiac disease within the next 6 to 9 months, and so you're dealing with the pain of and the reality of that, and then to have a technical breakthrough where we could technical and medical breakthrough so that we could then extend their lives, and usually for quite a length of time. It was challenging. It's something new there, other than just, you know, we'd doing the coronary bypasses and the bypasses and things.
Extending life, giving quality of life, but now we face some challenges, don't we? Receiving donations of hearts. What is that process? What are some of the concerns? Are we leveling out now on donations of hearts, organs? Catherine, can you talk to us about that?
I think overall donation has seen a leveling off. We've been trying to increase our donor pool to increase the number of donors, and what I mean by that is we are accepting patients a little bit older, up to 70 years of age, and we do look at the medical history. Before, several years ago, we might not consider somebody who had hypertension or who had diabetes, but now these patients can actually become donors if that's their choice.
A person who would say, well, I have hypertension. In the past, they would not have been accepted. Is that correct?
Correct.
And now they would be looked at as a possible donor.
Absolutely. Absolutely.
What are some of the other concerns that people have when they talk about the possibility, well, I'd like the idea, I'd like to maybe give one of my organs at the time of my death. What are some of the struggles that people go through?
Well, I think people hesitate to sign their donor cards because they believe that if I come to the emergency room with a signed donor card, the nurses and physicians won't do everything they can do to save my life, which is absolutely not true, because anytime a patient enters a hospital, the last thing people have on their minds or their concerns are is whether or not this person was a donor. I think also people fear that if I do agree to have my organs removed, then I won't be able to have an open casket funeral, which is not true. Anybody who is an organ or tissue donor can have a normal funeral. It won't delay the funeral, and they can still have an open casket. Also, families and sometimes people who want to donate fear that their bodies may be mutilated. But the surgery is just like any other surgery. The organ recovery is just like any other surgery that's performed in the hospital. And there is no mutilation, and there is no disfigurement at all.
This may seem rather strange to you both as professionals, but for we who are the lay people in the process, how does that all take place? A person is dying, has died. You keep that person's organs alive, the medical community, so that you can harvest those organs. Prior to that, you talk to the family in the procurement office, you receive their approval. What are some of the questions they ask?
They ask, one of the biggest concerns, one of my biggest concerns when I'm talking with a family is that they do understand that their loved one is dead. A lot of times, all the time, these patients are brain dead and in an IC, in an intensive care unit in the hospital. When someone is brain dead, they are either removed from the ventilator or they're maintained on the ventilator and they become organ donors. And my biggest concern is that these families understand that their loved one is dead because they're brain dead, but they're still on the ventilator, their heart's still beating, they're warm to touch, and I need to make sure that family understands that their loved one has died.
And we were talking before we started the program that the religious communities, all the major religious groups support organ donation, and that the church has spoken clearly that this is a sign of giving the gift of life. And so recycle oneself and don't bury those organs, but rather give them and donate them. We're going to take a short break, and when we return, we're going to learn firsthand on Austin Faith Dialogue about what it's like to be given a second chance at life. Stay with us.
It means serving you. Each day, Austin Metropolitan Ministries is religion in action, providing affordable housing, caring for the elderly, marching against hunger, and much more. AMM promotes understanding, cooperation, and social involvement. So when we ask for your help, we're really asking to help you, Austin. To find out how you can help Austin Metropolitan Ministries help Austin through its member organizations, just call 472-7627.
Welcome back to Austin Faith Dialogue. Joining us in our discussion on organ donation and transplantation are Bobby Richards, Seton Coordinator at Seton Hospital in a transplant program, and Smitty Smith, the second heart recipient at Seton. Bobby and Smitty, welcome to Austin Faith Dialogue. Good to have you here. What does it mean to be Senior Coordinator at Seton, Bobby?
To hear that makes me feel very old now. I've been there since the beginning when they first started planning the transplant program, and to watch the evolution has been incredible. Also to see the number of people that we have been able to offer a second chance at life, and to see them do well, to have an option other than dying, and to have their quality of life improved, and putting them back in the community where their family has just been incredible. It's been worth every long hour that we put in.
And you put in many long hours.
Usually when we do a transplant, it happens during the middle of the night, and you've been up all day, but it's worth it. I mean, you don't notice it then because the adrenaline's going, because you're so excited to finally have a heart for somebody.
Dr. Oswald talked a little bit about the history, starting with the kidney transplants and then going into the heart transplants at Seton. And you've been there since the very beginning, and that excitement that you have in giving this second chance of life, is that the major motivation of the organ donation and transplant program, giving people another opportunity to live this good life?
It is for me. I've worked intensive care units and coronary care units for a long time, and saw young, viable people literally struck down in their youth and in their productive ages where they had no chance, and they spent many days in bed. But to offer them the option and to see how well they can do after transplant, it's been incredible. We've done 69 now since we started, and the survival rate is about 80%, which is what it is across the country. So that means 80% of the people that would have been dead by 1 year are still alive and doing well. Most people can go back to work and enjoy everything that they did before they got sick.
What is incredible to me is when I make regular hospital calls in a hospital situation representing my parish, I think about the people who drive by and they don't know anything that's going on within those walls of the hospital, and you all are there fighting for life, wanting people to live, and wanting them not only to live, but to have some quality to their lives. And Smitty, that brings us to you, my friend. Welcome to Austin Faith Dialogue. You are the second recipient of heart transplant, and thanks be to God, you're in that 80%, aren't you, that have made it. When did your surgery take place?
My surgery took place July the 27th, 1986, which means it's been 6 years. I have 2 anniversaries, 2 birthdays, I'd say, a year. And at my church, I always say, well, it's another birthday for Smitty, because beyond a shadow of a doubt, I wouldn't be here today if I hadn't got the transplant.
When you were told that you were a sick man, that you had some very serious problems, What went through your mind? And then you've heard Catherine talk about the procurement. You know Bobby. What was going on in your family and in your personal life? So people watching this program say, I can identify with Smitty. I'm there.
Well, I was devastating because I did not believe I was that ill. I had gone to other doctors. They diagnosed my case, but never that I had a bad heart until I went to Dr. Goolsby, and he diagnosed my case. And when he told me I had a damaged heart and it would never get any better, I would be on medication the rest of my life, I almost had a heart attack.
Catherine, Bobby, is that typical? Is that the usual reaction of people when the medical community says your heart is damaged, you'll never get better? Is the reaction similar to what Smitty says? They can't believe it, disbelieve?
I think so. Bobby?
Oh, the denial is incredible in the beginning. I mean, people don't want to believe that they have no other option, that they have to go through something like transplant, because they're still so scared of it. You know, they still think of people like the man that was on the original artificial heart, who had a stroke and everything else, and they can't make the adjustment to people not looking any different and doing everything that they did before.
Exactly.
And nobody wants to believe you're that close to death.
Right.
We want to believe that we're going to live close to forever.
Right. That's typical of all of us.
What you have to understand, in my case, I was a 62-year-old man and hadn't ever been ill in my life. I had never been on medication. And the mere fact that doctor told me I would be on medication the rest of my life, man, it was devastating. I just couldn't believe it.
When did the idea come to you, or who made the suggestion that you might consider the heart transplant?
My doctors. And this is a story.
Okay, Smitty,
When
tell
my
it to us.
doctors confronted me, they said, well, Mr. Smith, we want to suggest that you think about having a heart transplant. And I said, no way. I was going to have to move to Houston and live in Houston and get on the program there because it wasn't one here. And I said, no way. I said, doctors, do y'all believe in God? And I said, I am going to put my life in God's hand. And I had no idea at this particular time. I was not aware that I was that sick still. And heart transplant was out, totally out. I thought I could make it without the transplant.
Smitty, Dr. Oswald said that one of the reasons we're starting the program here in Austin was the fact that the dislocation of people, having them move someplace else to a larger metropolitan area, is just what you were going through.
Yes.
I don't want to go to that particular place and possibly die.
I don't like Houston, and to have to move up there and live up, and then my family's here. And it would have been just too tough. I just couldn't.
What about your family? Did someone from the heart transplant office talk to your family? With Bobby, were you involved in that, or how did that all happen?
We always talk to the patient and their family because it is a family affair. There's no way that one person can go through the transplant without having an impact on everybody. And we really need their help. There's very few people that could get through something as major as this and as stressful as it is without the support of family, of church, of community. And it makes a big difference.
And Smitty, you mentioned you're a man of faith. And so you had the faith community, you had your family with you?
Well, let me tell you, sir, I had my family, my friends, everybody in Austin knows Smitty. I worked for the comptroller, I've catered, and everybody in Austin knows Smitty. So I had support from Austin, period. Everyone in Austin was supporting Smitty.
Then, Smitty, the reason we have you in Austin Faith Dialogue today, my friend, is for you to say to Austin community, we need people to consider seriously organ donations, right?
Yes, sir.
Will you tell your friends out there in Austin that?
Friends, we need hearts so others can live like Smitty. We need you to think seriously, and if I can do anything to help you or motivate you to get on the bandwagon as being donors, I'm available.
Smitty, for 6 years, you've had this second birthday, this second experience of life. What has changed in you? What have you experienced? And I think people watching Austin Faith Dialogue need to hear this because, this is a testimonial, my friend. What has organ transplant, heart transplant done for you?
My total life has changed.
Yes.
Total. I'm going to go back a little. I was brought up in church. Been a churchman all my life.
Right.
But I believed in some parts, but I believed that Smitty could take care of Smitty when it came down to that. But when I got ill, I found out it was no way. So I went back and rededicated my total life to God. And after that point, I did not have any problems. I used to get a kick in the hospital when the nurses and doctors would come in and say, Smitty, how you feel? I say, I'm fine. You know, I'd see him, and like, this guy doesn't know how ill he is, or he's a little off. Okay? I was called Cool Smitty, but what happened, I couldn't explain to him what happened till after the operation. Then I was confronted. Smitty, why? Did you know how ill you were? I said, yes. I said, but I didn't have any words because I gave my problems to God. And when you do that, you don't have any problems.
Smitty, I think that what you've said today on this program is going to ask a lot of people to look inside themselves and say that we want to assist people in living life. Now, Catherine, Bobby, what if people want to do that? What if people want to become a part of the organ transplant experience and say, I want to recycle my life? What do they do? How do they get hold of you all? What's the process?
Well, we just ask that if they'd like to receive a donor call, they can give us a call, a donor card, they can give us a call on our 1-800 number. Or, but more importantly, it's important that they discuss donation today, now. Maybe the audience, while they're sitting around watching this, can discuss it now, decide whether or not they want to be a donor.
Yeah, that's very good, because Dr. Oswald said before we went on the air that they don't want to wait till someone gets sick. They want to start that decision process right now.
Right. It's very important to discuss with your family now versus later.
And tell me why. What is the reason for that?
Because when the families, when you enter the hospital and if you are identified as a potential donor, then we always approach families about that option. And families that are informed their loved one wanted to be a donor have a much easier time of making that decision because they know that's what their loved one would have wanted.
Bobby, they've expanded the criteria for those who are able to donate. Is that correct? Because we've kind of leveled off, I think Catherine said, in donation of organs. They've expanded that. Talk to us a little bit about that.
We know that there are people out there that live a lot longer than what they did before that are still healthy. And before, we didn't take organs from patients who were over 40, you know. And they said as the surgeons got older, then they expanded the criteria, not only for donors, but also for patients who are recipients. And so now we can use donor organs from people who are older as long as they were basically healthy. And we also know that people who receive organs can do well, can survive and have a good quality of life even though they're older, and that they deserve just the same option as everybody else.
You have been there since the beginning of this Seton program. What has been the joy, the excitement, and also the sadness? 80% success rate, long hours. What has it meant to you to be a part of all of this?
One of the things that I've learned is how much people can give to each other and how much joy there is in life. And even though the sad times, it makes it all worthwhile when you sit down and find out how people are doing and just that sharing. And even though there's sadness and even though the times get hard, I really find that they touch a lot of lives and it really makes a lot of difference.
If you were going to tell people watching Austin Faith Dialogue a message, if you were going to say a word to them as they watch this program, speak to them. Tell them what you suggest they do.
I suggest that they stop and really look at what life means for them and what their loved ones mean to them and what they want to still accomplish. I think that a lot of the patients that we see still have a job that they need to do. And that's the reason why they're brought for transplant and the reason why they survive. God still has some plans for them and their life can be good. The quality is what's important.
And Catherine, you just returned from Seattle, Washington. You were up there working with them, and now you're back in Texas. And what has the program meant to you and your nursing career?
It's been the most important thing in my life. I think getting the opportunity and the privilege to work with families who have suffered a tragic, traumatic, sudden loss is, I have learned so much from every family I've had the privilege to talk to. I have